Hi everybody, this video of mine is very important and you should watch it from the beginning till end because I'm going to discuss the most common problem which we come across as a doctor, and that is sore throat. But remember that sore throat is sometimes it's not simple, okay? So I will highlight those conditions in this video which are dangerous and which are really a matter of concern in this video, because simple sore throats I think most of the people must know it's due to virus and it can be easily treated at home. That I will also discuss in this video, but my emphasis in this video is to tell you those conditions which can be dangerous. Signs and symptoms may include pain or scratchy sensation in the throat, pain that worsens with swallowing or talking, difficulty swallowing, swollen glands in your neck or jaw, swollen red tonsils, and there also it can present with white patches or pus on your tonsils. It can also present with a hoarse or muffled voice. Infections causing a sore throat might result in other signs and symptoms, which include fever, cough, runny nose, sneezing, body aches, headaches, nausea or vomiting. Okay, you should take your child to a doctor if your child's sore throat does not go away with the first drink in the morning. This is a recommendation of the American Academy of Pediatrics, so this thing you should keep in mind. You should get immediate care if your child has severe signs and symptoms, which I am going to tell you now. These symptoms are like difficulty breathing, difficulty swallowing, unusual drooling, which might indicate an inability to swallow. So if your child is suffering from these symptoms, you should seek immediate care. Okay, if you are an adult, see your doctor if you have a sore throat and any of the associated problem which I am going to tell you. This is a recommendation of American Academy of Otolaryngology, that is head and neck surgery. So I am going to tell you those recommendations right now. If a sore throat that is severe or lasts longer than a week, if you have difficulty in swallowing, difficulty in breathing, difficulty opening your mouth, joint pain, earache, or if you have any rash on your body, fever higher than 101 Fahrenheit or 38.3 degrees centigrade, blood in your saliva or phlegm, frequently recurring sore throats, a lump in your neck, hoarseness lasting more than 2 weeks, swelling in your neck or face. So these symptoms you should note down, because if an adult has these symptoms, then you should seek medical care. Okay. Now let me tell you the causes of sore throat. Viruses that cause the common cold and the flu also cause most sore throat. So this thing you should remember. Okay. Less often bacterial infection cause sore throats. Now coming to the viral infection which cause sore throat, these include common cold virus, influenza virus, mononucleosis, that's also known as kissing disease. Also measles virus can cause sore throat. Chickenpox virus is also sometimes responsible for sore throat. Okay, and recently this coronavirus pandemic is it's all over the world, and that can also present with the sore throat. So this is another common cause of sore throat nowadays. Okay, and there is a condition known as croup, which is a common childhood illness characterized by harsh barking cough that can also cause sore throat. Now coming to the bacterial infection, a number of bacterial infections can cause a sore throat. The most common is streptococcus pyogenes, which is also known as group A streptococcus, which causes strep throat. Other causes, here I would like to mention other causes, because as I told you earlier in this video, it's not simple sore throat which I am discussing in this video. I'll discuss other conditions which can cause a sore throat and that can be serious. Okay. Well, in addition to viral infection which I told you before and bacterial infections, there are some other causes of sore throat which include allergies. Allergies to pet dander, molds, dust and pollen can cause a sore throat. The problem may be complicated by postnasal drip, which can irritate and inflame the throat. Dryness. Dry indoor air can make your throat feel rough and scratchy. Breathing through your mouth, often because of chronic nasal congestion, also can cause a dry, sore throat. Irritants. Outdoor air pollution and indoor pollution such as tobacco smoke or chemical can cause a chronic sore throat. Chewing tobacco, drinking alcohol and eating spicy food also can irritate your throat. Muscle strain. You can strain muscle in your throat by yelling, talking loudly, or talking for long periods without rest. So that strain of muscle can also irritate your throat. Now there is another condition that is known as GERD, which is a gastroesophageal reflux disease, GERD, which is a digestive system disorder in which stomach acid backs up in the food pipe, that is esophagus. Other signs and symptoms may include heartburn, hoarseness, regurgitation of stomach contents, and the sensation of a lump in your throat. So GERD can also be associated with sore throat. Okay. Then another cause is HIV infection. A sore throat and other flu-like symptoms sometimes appear early after someone is infected with HIV. Also, someone who is HIV positive might have a chronic or recurring sore throat due to a fungal infection called oral thrush or due to a viral infection called cytomegalovirus, which can be serious in people with compromised immune systems. Tumors. Cancerous tumors of the throat, tongue or voice box, that is larynx, can cause a sore throat. Other signs or symptoms may include hoarseness, difficulty swallowing, noisy breathing, a lump in the neck, and blood in the saliva or phlegm. Rarely, an infected area of tissue, which is abscess in the throat or swelling of the small cartilage, that is lid that covers the windpipe, that is epiglottitis, can cause a sore throat. Both can block the airway, creating a medical emergency. So these are the causes of sore throat. I think you must have listened it carefully. Now coming to the risk factor. Although anyone can get a sore throat, some factors make you more susceptible, which include age. Children and teens are most likely to develop sore throats. Children ages 3 to 15 are more likely to have streptococcus throat infection, which is the most common bacterial infection associated with the sore throat. Exposure to tobacco smoking and secondhand smoke can irritate the throat. The use of tobacco products also increase the risk of cancer of the mouth, throat, and voice box. Allergies. Seasonal allergies or ongoing allergic reactions to dust, mold, or pet dander make developing a sore throat more likely. Exposure to chemical irritants, particles in the air from burning fossil fuels, and common household chemicals can cause throat irritation. Chronic or frequent sinus infection. Drainage from your nose can irritate your throat or spread infection. Close quarters. Viral or bacterial infections spread easily anywhere people gather, whether in childcare centers, classrooms, offices, or airplanes. So, whenever there is too many people, and in an environment, then they can spread infection. Okay. Then if there is a weakened immunity, if you are more susceptible to infection in general if your resistance is low. Common causes of lowered immunity include HIV, diabetes, treatment with steroids or chemotherapy, drugs, stress, fatigue, and poor diet. Okay. Regarding this, I have also a video about foods which can boost your immunity on my channel. So please watch that video. That is also very good video. Okay. Now coming to the preventions. The best way to prevent sore throat is to avoid the germs that cause them and practice good hygiene. You should follow the tips which I am going to tell you and teach your children to do the same. You should wash your hands thoroughly and frequently, especially after using the toilet, before eating, and after sneezing or coughing. Avoid sharing food, drinking glasses, or utensils. Cough or sneeze into a tissue and throw it away. When necessary, sneeze into your elbow. Use alcohol-based hand sanitizer as an alternative to washing hands when soap and water are not available. Avoid touching public phones or drinking fountains with your mouth. Regularly clean telephone, TV remotes, and computer keyboards with sanitizing cleaners. When you travel, clean phones and remotes in your hotel room. Avoid close contacts with the people who are sick. So these were some preventive measures. Now I'll tell you about the diagnosis. It's usually very simple when we see patients in our clinic. Then on simple examination we can determine about sore throat. Well, you or your child doctor will start with a physical exam that will include using a lighted instrument to look at the throat and likely the ears and nasal passages, gently feeling, which is known as palpation, palpating the neck to check for swollen gland, which are lymph nodes, listening to your or your child's breathing with a stethoscope. So these are the diagnostic methods which used to diagnose a sore throat. Well, coming to the throat swab, in many cases, doctors use a simple test to detect streptococcal bacteria, which is the cause of streptococcal throat infection. The doctor rubs a sterile swab over the back of the throat to get a sample of secretion and sends the sample to a lab for testing. Many clinics are equipped with the lab that can get a test result for a rapid antigen test within a few minutes. However, a second, often more reliable test called a throat culture is sometimes sent to a lab that returns results within 24 to 48 hours. Rapid antigen tests are not as sensitive, although they can detect streptococcal bacteria quickly. Because of this, the doctor may send a throat culture to lab to test for streptococcus throat if the antigen test comes back negative. In some cases, doctors may use a molecular test to detect streptococcal bacteria. In this test, a doctor swipes a sterile swab over the back of the throat to get a sample of secretion. The sample is tested in a lab. Your child doctor may have accurate results within a few minutes. Now coming to the treatment. A sore throat caused by a viral infection usually lasts 5 to 7 days and does not require medical treatment. To ease pain and fever, many people turn to acetaminophen, which is come with the name of Tylenol and some other names, or other mild pain relievers. Consider giving your child over-the-counter pain medication designed for infants or children, such as acetaminophen, that's children's Tylenol, fever, or ibuprofen to ease symptoms. Never give aspirin to children or teenagers because it has been linked to Reye's syndrome, which is a rare but potentially life-threatening condition that causes swelling in the liver and brain. Treating bacterial infection. If your child's sore throat is caused by bacterial infection, your doctor or pediatrician will prescribe antibiotics. Your child must take the full course of antibiotic as prescribed even if the symptoms are gone. Failure to take all of the medication as directed can result in the infection worsening or spreading to other parts of the body. Not completing the full course of antibiotic to treat streptococcus throat can increase the child's risk of rheumatic fever or serious kidney inflammation. Talk to your doctor or pharmacist about what to do if you forget a dose. Other treatments. If a sore throat is a symptom of condition other than viral or bacterial infection, other treatment will likely be considered depending upon the diagnosis. Now I'll tell you some lifestyle and home remedies. Regardless of the cause of your throat, some home care strategies can help you ease your child's symptoms. These are rest. Get plenty of sleep. Rest your voice too. Drink fluids. Fluids keep the throat moist and prevent dehydration. Avoid caffeine and alcohol, which can dehydrate you. Try comforting foods and beverage. Warm liquids such as broth, caffeine-free tea, or warm water with honey, and cold treats such as ice pops can soothe a sore throat. Gargle with salt water. Well, this is very important. Okay, a salt water gargle of 1/4 to half teaspoon, which is 1.25 to 2.5 milliliter of table salt, to 4 to 8 ounces, which is 120 to 240 milliliter of warm water, can help soothe a sore throat. Children older than 6 and adults can gargle the solution and then spit it out. So this is a very important. Normally, because as I told you, the most common cause of sore throat is viral infection. So normally, these gargles and taking simple medication such as acetaminophen for fever may all be what you need. Okay, I mean these simple treatment like gargles and this acetaminophen are enough for simple sore throat due to viral infection. Okay. But as I mentioned before, this video is not just telling you the simple treatment of sore throat. Here I want to highlight the more serious causes of sore throat in this video. Okay. Now another home remedy is that you should humidify the air. Use a cool air humidifier to eliminate dry air that may further irritate a sore throat. Being sure to clean the humidifier regularly so it does not grow mold or bacteria. Or sit for several minutes in a steamy bathroom. Consider lozenges or hard candy. Either can soothe a sore throat, but do not give them to children aged 4 and younger because of choking risk. You should also avoid irritants. Keep your home free from cigarette smoke and cleaning products that can irritate the throat. Normally we do not recommend alternative medicine, but since it's being a doctor, I should tell you what is good and what is bad for you. So I should also speak something about alternative medicine. Although a number of alternative treatments are commonly used to soothe a sore throat, evidence is very limited about what works. If you or your child needs an antibiotic for a bacterial infection, do not rely on alternative treatments alone. So these things you should keep in mind. Normally, personally, I do not recommend alternative medicine. Okay. You should check with your doctor before using any herbal remedies, as they can interact with prescription medication and may not be safe for children. Pregnant and breastfeeding women and people with certain health conditions may be more at risk. Okay, herbal or alternative products for a sore throat are often packaged as teas, sprays, or lozenges. Common alternative remedies include slippery elm like gorse root, marshmallow root. So, as I told you, personally, I do not recommend these herbal treatments for sore throat, because they can interfere with the prescription medicine, and also they can be dangerous with for the children, for pregnant women or breastfeeding women. So I do not personally recommend any alternative medicine for sore throat. Okay, as I told you, in most cases the cause is very simple, viral infection, and it usually resolves within 5 to 7 days with simple home remedies, which I just told you. Okay, I mean, like doing gargles and using just simple acetaminophen. Okay, and but in some cases, if you are if you are diagnosed with a bacterial infection, just streptococcal infection, or other causes which I told you in this video, then in those cases should be treated adequately with appropriate treatment. Okay, so I hope you like this video of mine. Until now, if you haven't subscribed my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think that my video provides some sort of benefit, even it's a little bit benefit, please give a thumbs up to this video, because this will give me more encouragement to make more useful videos like this. Okay, and do not forget to share my videos to your family and friends, and on social media such as Facebook and Twitter.